Thank you. We want to thank you all for inviting us to this. Like I said, we are the Rolling RNs. We started this, I started this actually probably about 2010, 2011, because I did not want to keep all the information in my brain after my spinal cord injury. So I decided I wanted to start the Rolling RN. Roberta joined me, 2015 or so?
15, I think 2015.
Roberta joined me, and she and I both play off of each other and provide articles, try to provide monthly articles via Facebook. So all of this information that we have is from our Rolling RN Facebook page. So let me get started here and we'll talk some about who we are. Let me get this. And share.
Ooh, that was quick.
Oops. All right. For you all that don't know me, I graduated in 1983 from nursing school, and I had worked spinal cord injury right out of nursing school. So when I had my own spinal cord injury, I knew a little bit more than probably I needed to. So made me a little bit nervous knowing what I knew. But I most recently taught nursing to students prior to my accident, and I write as the Rolling RN. But in 2009, I had a car accident, my husband and I, and resulted in broken arm, 2 locations, broken hand, dislocated knee, and complete severing of my spinal cord, which left me as a T3, T4 paralysis, 6 weeks hospitalization, 8 weeks rehab followed that. And as you can see, that is me visiting beautiful area of Ottawa, which was lovely, but that's all of Canada. I have to apologize that I have seen from there. But it is beautiful there. I'll let Roberta introduce herself.
Hello, everyone. Yes, I have been a registered nurse since 1997, and I worked in different specialties, worked in family practice in Grand Rapids, Michigan. And then when we moved to Dallas, Texas, I started out in allergy and immunology and stayed with that for about 9 years. And then I took my nursing to a different level and did specialty pharmacy education and counseling. And specialty pharmacy is here in the United States are the different drugs that treat multiple sclerosis and different types of cancer treatments that are taken orally, that kind of thing. And then after that, I went to work for an insurance company here as an RN health coach. And then that's right after I started working there, that's when I ended up having my accident. I was injured in an ATV accident in May of 2014. And that caused paralysis from the chest on down, T3 complete, much like Patty. So we had quite a bit in common with not only our injury level, but our ages, where we were in life with raising families and, being married, children, all that. So this is where we're at. This is how we met each other. I'll let Patty take it from here.
And we have not physically met each other, which is very sad, but we do play off of each other constantly. So. But we did want to talk about, this is our first time talking about this, so bear with us. We'll certainly leave it open to questions, but we want to just talk about the fine art of balancing spinal cord injury and aging. And it is a juggling act. So like I said before, all of these articles, all the information we provided are written in total articles on the Rolling RNs via the Facebook. So if you want to look into more information, you certainly can, but we're just hitting on the surface level of all of these topics. what I want to say right off the bat, and I don't mean this ugly in any way, is you can't expect an able-bodied person to think as a spinal cord injury person that it's never going to happen. So, when you go to your doctor and you think they understand, they really can't understand. And I think you all know that, but I always want to put that at the very beginning, that they can't think that. So you kind of have to help them and do a lot of education as it goes along. We wanted to review. I didn't want to go into UTIs. I didn't want to go into bowel care because you all know that stuff. But I want to go into the weight, diabetes, heart disease, skin breakdown, osteoporosis, blood clots, and protein as we age. And Roberta's going to certainly be putting her 2 cents in as we go along. But this is the topics that we were looking at going over right now. So we start off with weight, and you all know this, being in a wheelchair, we have a tendency to gain weight, which decreases our independence. And it also causes, changes in the body composition. You don't have the muscle mass that you had before. So it makes life a little bit more difficult. But you all know that stuff. So because of the spinal cord injury, having the reduced activity, there are guidelines for, weights and all that you should be looking at. And the guidelines suggest that if you're paraplegic, that you should be consuming about 28 calories per kilo, which, and as I said, if you're tetraplegic, quadriplegic, you should have about 23 calories per kilo. So that information is here to explain how that works, but they're pretty much average. If you're 175 pounds, you should be consuming about, that equals about 79 kilos. That's about 1,800 calories per day. These are guidelines. They're just ideas for you to keep up with so you can watch your weight, because I know as years go on, we do gain weight and it makes it difficult transferring and the whole bit. And then going into weight, diabetes goes along with that. And spinal cord injury, some research suggests that diabetes and spinal cord injury go hand in hand. So just to touch on this, when you go to your doctor, he needs to be doing lab work to see what your blood sugars are doing, see what's going on, see if you need help with diabetes. And some of the common symptoms are the dehydration, excessive urination, extreme thirst, increased appetite, and a weight change. So that's some of the information there. Like I said, we've written articles on all of these topics, so you could certainly go back and look, but that's some of the, if you have diabetes, these are some of the symptoms that you're looking for.
I think she's referring to like the type 2 diabetes. So as opposed to, that's something that you're going to see more with as people gain weight. That's where you're a little bit predisposed to the type 2 diabetes, as opposed to type 1, where that's usually juvenile onset or early onset. So just wanted to clarify the difference on that.
Right. Roberta's the expert more in diabetes than I am. So I always talk to her about the diabetes part. But is there anything else, Roberta, that we need to go over?
No, otherwise I think that's good.
Okay. Heart disease after spinal cord injury is the leading cause of morbidity and mortality in our population. And reason being is because we do not do the regular exercise for the cardiac health benefit that able-bodied would be doing. I know we can do some exercise, and that's great. Anything we can do is helpful for our heart. But I know we are at decreasing the amount of exercise that we do. But just to know that it is increased mortality in spinal cord injury group, which is very sad, but it's a situation. So Skin breakdown is a big one. Pressure sores results from sitting too long, lying too long in the bed. But what happens as our skin ages, it becomes much thinner and less elastic. So good, you definitely need to check your skin every single day. And we're going to talk more about how we can improve our skin at different stages and all. And if you want to, people do it all the time. They message me across Facebook and say, this is what I have. What do you think? Roberta and I both have gone through pressure sores. We play off of each other and what we suggest to do. Mainly, it's just taking time to allow the skin to heal. And skin healing is at a decreased rate because of us being spinal cord injury. Roberta, you have anything for that?
Nope, you've covered it.
So then there's the 4 stages of skin breakdown too. So you all know, I would think maybe most of you have had some type of skin breakdown. I know I did initially right after spinal cord injury. I didn't get turned in the hospital as should be. So I did have a skin breakdown on my butt. It did take a long time to heal, but we've all been through that. So just to know, a little bit of extra cushioning is good. So, osteoporosis. This is a drawing that's actually, we have an illustrator too with the rolling RNs, and Mitzi is our illustrator, and she had done this, which I thought was a really cool picture that we had done for that. So with spinal cord injury, osteoporosis is very common complication that goes along with the lab work that I originally said. When you go to your physician, that you have your lab work done, you have your diabetes checked, you have your blood sugars checked, you have your vitamin D levels checked, see what's going on with your bones. Because what happens is being inactive for the long periods of time with little or no exercise, it causes our bones to break down. So osteoporosis is mainly just a disease that makes your bones thin and brittle and easy to break. And I know, say we fall out of our wheelchairs, we don't know it or don't feel it, your bones can easily break. So, you got to make sure you get your increased calcium, increased vitamin D, get those vitamin D levels checked. Also get the bone scans done. Check those kind of things just to make sure your bones are where they're supposed to be, especially as you age. Now, I know Roberta knows a lot more about the osteoporosis. She's on medication to help her bones.
Yes. Well, again, the fact that we can't bear our weight, and that's supposed to help encourage bone growth and bone density. And again, like Patty said, since we're sitting, we're just not, we're a little bit more prone to that. And then even women, as far as aging goes, as you go through perimenopause and menopause, that sets you up for even greater risk for being or having the osteoporosis. So as Patty says, it's just really smart to go in and get those levels checked, have your bone density done. And from there, you can find a doctor. We use rheumatologists here or an endocrinologist. Those are the types of doctors that can help us. Even a general practitioner can help you to look at what your options are. And in the United States, there's several different types of medications that you can take oral or by IV or injection. So there's different types of medications available here. And that's something that you want to discuss with your doctor, but really important to have that conversation because we are so brittle. And as Patty says, you could just moving and transferring or rolling around in your bed can cause a break. So need to be looking at your body. If you see any extra redness or swelling and anything that looks unusual, make sure to get that checked out. So that's all I've got, Patty. Anything else?
I think that's it. You covered it.
Okay.
Here's our risk factors: alcohol use, steroid use, low calciums, low estrogen, which goes along with the menopause as we age, the smoking, and the sedentary lifestyle, which is us sitting. So it all can lead to osteoporosis. Blood clots, that's another biggie. It happens because we sit all day long. The blood doesn't move as we normally would have it moving by walking. So it happens sitting in our wheelchairs for extremely long periods of time can cause blood clots to form. They're going to also hear them called as DVTs, which are deep vein thrombosis, and their formation in the clots usually that are forming in the calf or the thigh muscles, and they stop the blood flow. So it causes chronic pain, chronic swelling, which we may not feel, but if you watch your leg, it goes along with that leg skin check. It's one way to know. What happens is the clots just start forming from the lack of activity, that the blood is just not flowing as it should be flowing. They don't know I'm there. Symptoms of the DVTs or the blood clot may be a swelling in one or both legs, and that's not to be confused with the edema that we have from sitting. The pain or the tenderness in one or both legs, which is difficult for us to assess. Warmth in the skin of the affected leg, and that you can easily assess. If you notice that your leg is swollen, if you notice that your leg may be red, and if you notice some warmth, you need to immediately notify your physician. Also, you may see some visible surface veins or leg fatigue, which is also a symptom, but that's difficult for us to assess also. But you don't want those clots to let go, separate, and move to either your heart or your lungs. That's why you have to be so careful with them. So leg exercises is a great suggestion. Also wearing those TED hose or the compression stockings that we all wore right after spinal cord injury. And I know we all hated them. I know I hated them. They're difficult to put on, but what happens with those, they compress the limbs and they cause pressure against the legs, causing or reducing the diameter of the descended veins. So they increase the blood flow. And these are really good. I especially wear my compression hose on long trips. Anytime that I'm not going to be moving my legs or on any type of flights, I also wear those compression hose so that make sure that I don't get those blood clots in my legs if that happens. You know, if you do get the blood clots, they do put you on medication, which causes your blood to be much thinner, which causes you to be cold all the time. So it's like this vicious cycle that you don't want to happen. So it's better off to avoid these blood clots from happening. Protein is the biggie topic that we want to go over. Protein is huge, huge, huge. The longer we are sitting in our wheelchairs and the older that we're getting. And why is that so necessary in spinal cord injury? Protein is essential for life and it plays many, many roles. It makes the tissues. It includes the muscle, the skin, the hair. It produces enzymes in your body. It makes your hormones. It makes your antibodies. And then it converts glucose to act as an energy source if there's an inadequate supply of carbohydrates. Protein is a huge, huge factor that we need. But protein, the whole big thing with protein, it is not stored to draw on. So because we need the protein so much, we have to consume it in every single meal or in our snacks or any time throughout the day. We need to try to be consuming some protein. So people with spinal cord injury, we all have the same protein needs. as a general public. But what happens is if we need it for wound healing or any of these other things to help, protein is huge in the wound healing. So I gave you some parameters here for the wound healing, for the proteins that we need. So and it goes back to figuring how much kilos you are per your body weight. And people without spinal cord injury, with spinal cord injury, but without wounds, only need about a gram of protein per kilo per day. And if you figure that, that's still a lot of protein. So what I do, and I know Roberta does, is every single meal we watch to make sure that we're getting some type of protein in our bodies for that reason, because we are a spinal cord injury and we don't want something to happen. But if you end up with, say, a stage 2 or stage 3 or 4 pressure sores, you need to up that protein to help the body heal, because it's difficult for those pressure sores to heal without that protein. It's also some drawings by Mitzi. Now, as I say in closing, we can all see that the topics we've discussed have all got to be in the forefront of our healthy living every single moment of every single day, being spinal cord injury. So we have to remember the protein. We have to remember getting ourselves off our butts. We got to remember to do our exercises, especially when we're aging. It's all of this. It doesn't just happen. We all have to remember what needs to be done every single minute of every single day with us in spinal cord injury, because we don't feel what's going on in our bodies. So they've got to be incorporated into a healthy, aging, spinal cord injured body. So Roberta, you have anything else you want to add?
No, you covered it.
So I know Terry told me that you all were going to have some questions. So we wanted to know, Roberta and I are both here to help answer any questions that you may have about spinal cord injury and aging. And like I said, this is just a discussion time. We wanted to just hit on the topics that we thought were important for aging. Like I said, the UTIs, you should have that under control. The bowel care and all should be under control. So what other questions did you all have that you wanted to at least have some discussion on?
Anybody want to pipe up? I know I always have questions. So can you stop sharing your screen there, Patty, so then we can see your full face?
Sorry.
Awesome. There we go. So I guess like my first question, I know this is kind of a bit UTI related. One thing that I've found is a lot of people that seem to be, especially women that are aging with spinal cord injury, seem to have constant bladder infections, and that they can't get rid of. So do you have any idea of what that could be causing? Or
Roberta and I discussed this a lot. Roberta, do you want to put your 2 cents in?
Well, go ahead.
We both have different thoughts on the whole bladder infections. I myself use the, what is that, Roberta, that I'm using now?
Foley.
Yeah, I have the Foley, and then I take the, what's those tablets I take?
The oxybutynin?
Oh, no, the...
Oh, are you talking about cranberry or?
Yes, duh. Yes, cranberry tablets. I do cranberry tablets, and that works for me. But I hear that doesn't work for everyone. I have a Foley catheter that I change every 2 weeks, the whole setup every 2 weeks. That works for me. I take cranberry tablets 3 times a day. That seems to work. I don't touch my routine at all. But that works. I may get a UTI or bladder infection maybe once, maybe 6 months to a year, but that works for me. I drink fluid water all day long. So you see me always sipping away at something, but I flush my system out. Roberta's got a different system for her urinary system.
Well, and two, as we are aging, especially women that have had children, we find that our bladders tend to shrink, or they prolapse, where they don't hang, or I don't know what the right word to say is, but they're not tight in the system like they used to be, and you can have issues there. And all of that can, and a thinning of the lining of the bladder, that can all happen with age. So that might be part of the reason that people are maybe seeing more of that as they age. But again, too, it depends too how people, it's individual. How do people go to the bathroom? Do they do intermittent catheterization? Do they use Foley's? Do they have suprapubics? Depending on that, you'd have to probably get down to the bottom of, are they sterile or being clean with their technique? And then water is so important. Lots of water needs to be flushing that bladder out. Alcohols and sugar, caffeine, those can all irritate the bladder. So again, you got to look at what's going in and how much is coming out. So those are all really important things to be thinking about. So it's really individualized, I think, depending on how people do their routine. I like Patty. I take a cranberry supplement every day. It's called Allura. That's what we get here in the States. My urologist recommended it, and it has really helped me to keep free from UTIs. And there's a component in the cranberry that causes the bacteria from staying to the sides of the bladder. So it allows it to just flush right out. That's helpful. There's another component that some people use here called D-mannose, and it's supposed to help with the E. coli bacteria that gets into the bladder, usually from a contaminated catheter, that kind of thing. So that's another recommendation some people have said. And again, I think just pushing the fluids, going to the bathroom frequently so you're not getting a full bladder and holding the bacteria in your bladder. I think those are all really important things that you need to think about.
Tom, you have a question there?
I for one, don't have many bladder infections. I probably have 2 years, if that. I don't drink a lot of water. I do take the cranberry pills twice a day. What I do find is, one thing is your immune system, that's what you have to build up. And whatever's in your system in the way of urine, as long as you're flushing it, you should be fine. I'm one that was raised, I spent some time in the Army, and we were told basically, don't drink water. If you don't need it, don't drink it, don't depend on it. And so now, drinking a liter of water a day to me is ridiculous. That's way more than I'd ever do it. I might have it for other things. The key for me, I'm a diabetic too. I just stay away from the sugars. Anything like that is just basically a culture to help bacteria grow. And so that means in my system, I have to wash sugars. That's half the battle. And you're right about the protein thing. Protein helps. It helps. You need that protein to mend wounds. And I wouldn't doubt, I don't know anything about it, but I wouldn't doubt protein is also helping in this bladder infections. That's for what it's worth.
Mm-hmm. Thank you, Tom. Yeah, thank you for that feedback. Yeah, I think I can relate a little bit. If I was to drink like so much water, I find myself like just peeing basically all the time.
Well, you're right, Terry, and that's the reason I have the Foley for that reason, is because I do drink so
Right.
much. I would be caffeine every hour
Yeah.
if I didn't, so.
Yeah, it's finding that balance, that's for sure.
Exactly.
Absolutely.
It's not as simple as to drink. Well, what am I going to do? Stay home and go pee all the time?
Yeah, is that Kim?
Oh, sorry, I was just talking to someone.
Oh.
I was just saying, it's difficult. I was talking to someone who's here. It's not that easy to just drink, because if you need to find a bathroom during the day, it's not as easy as people think. And then at nighttime, which might seem like a good time to drink, then I get up all night going to the bathroom and don't sleep.
Yeah, it's finding the balance, but if nothing else, when you are drinking, make sure it is water, as opposed to some of the other things.
Right. Yeah. Does anyone else have any sort of questions? I always have tons, so I'll just keep going, but I want to open it up to you guys for comments.
What about incontinence issues? It seems to really restrict, like when you are trying to exercise and then you're having to worry about gonna leak.
True.
Yeah.
Yeah, and here in the States, again, there's medications that the urologist can recommend that helps to, I'm trying to think of the word I want to use, but it's supposed to keep you from having to go so often.
Someone's phone is going on.
Sorry, you're completely breaking up. I'm getting some music or something.
Yeah.
Somebody's music playing.
Okay.
Go ahead,
I
Roberta.
missed most of that.
But yeah, there's some medication out there that my urologist recommends, and it's supposed to help again to keep the bladder from spasming and to release. To hold, so you can hold the urine a little better. And again, as we age, that's still one of those problems. Sometimes it's a matter of getting a surgical procedure done. I actually had my bladder augmented. So they made it bigger so I could hold more. And in doing that, I haven't had any issues since with the incontinence. And
I think mine isn't it.
What's that?
It's not from spasticity, and it's not from, my bladder will hold a lot, but it just, if I exert myself, it's like a weak.
Yes, a weak sphincter probably.
Yeah, is that something that can?
That's something you would talk to
or is that?
Talk to your doctor about that. Again, they have procedures that they can fix just that. It is a matter of, like I said, the incontinence, it's stress incontinence is what they call that. And it's, when you sneeze or cough or you push down or, bend over, that's all it takes. And there are procedures that can work with that, and maybe even medications. So it'd be worthwhile checking in with your doctor.
Okay.
And that definitely comes with age too.
Yeah, for sure.
It's not just spinal cord injury, it's all of us as we age.
Right. I also have a question about arthritis. I'm getting arthritis in my hands and I'm getting arthritis in my back. Is there, like, I go back and forth between, well, if I'm getting symptoms of arthritis in my hands, do I exercise more? Do I exercise less? Do you try and stop putting stress on the limbs that are affected, or do you do more? What's the...
Yeah, Patty?
I was going to say, Roberta, I personally have arthritis in my shoulders. And that's why, as a paraplegic, I'm in a power chair. I was told that I had arthritis in my shoulders. I was told either power chair or shoulder replacement. I was not going through the rehab for the shoulder replacement. So I myself limit my exercise for my shoulder pain, because the shoulder pain increases need for pain meds or whatever the case may be. And I don't want to do that either. So I do limit my activity in my shoulders. But as for your back, your arms, your arms, you may
I see you're at the meeting,
some exercise.
but I don't have any audio, so I don't know what to do. Anyway, talk to you later. Bye.
Sorry, if you guys could just mute yourselves, that would be great, because when you're talking and you're not on mute, we hear you. Otherwise, I'm just going to have to mute everybody. So, sorry, Joan.
Roberta, what's your thought on exercise and arthritis in arms?
Right. For hands, for arms, for backs, first of all, again, sometimes going to the doctor and letting them know what's going on, because they can do lab work to decide if it's something rheumatic arthritis or if it's just from overuse. And it's better to keep moving as long as you don't overdo against finding the balance, because you want to keep those joints moving. Otherwise, they do tend to get stuck in a place and they get sore. But also, depending on what type of arthritis you have, again, medication, but different types, because you can't consume too much of the ibuprofen that wreaks havoc on the stomach. So it turns into a vicious cycle. But again, that's definitely worthwhile talking to your doctor. Physical therapy can help too, depending on what type of where your arthritis is. They can give you exercises to work those areas. A lot of it is stretching the muscles that go with the bone to help.
I do try doing a lot of stretching. And I think that's probably keeping it at bay, but it's still, I'm only 57. I don't want to be getting worse.
Right.
And those exercises help Joan in many other ways too, not just for the arthritis, but for many other ways too, the cardiac and all, which is great. Great that you're exercising like that.
Yeah, and as far as your back goes too, you need to check that your chair is fitting right for you, because if you're not in a good position in your chair, that's going to cause more stress on the muscles and nerves and right into the spine, and that's going to make it worse. So make sure that you're sitting correctly in your chair. We go to a seating specialist to get that checked out in our chairs. So
I'm kind of in a rural area. There's not a lot of that. Too much available. I'd have to travel pretty far to do that. I have tried that, but like I say, the further away you get away from the big centers, the less quality you get.
It turns into, it's hard to get to. I understand.
It is.
Hi, my name is Teresa, and I have the arthritis in my hips as well. I'm a quad. So I find that I have it in my hands, and that my hand function as much as I found that precious is because it's so limited. My finger dexterity is pretty limited, but I'm finding even disappearing, and so I'm dropping things that more difficult to pick them up. And the weather does affect it, and my hips as well. I don't know what to do about the hip thing. If you have any suggestions about what one could do for arthritis in hips too. I haven't checked it out at all.
You haven't checked it out?
No. And I don't know if I should just go to a GP or physiatrist or...
I always feel physiatrists are great resources, especially for pain. Roberta, what's your thoughts?
Well, they understand our issues sitting in the chair and the type or the lack of the movement or that the way that we can bend or not bend, that kind of thing, and what sets us up for the pain in different places. So they're a good resource. And again, they can connect you with a physical therapist that can work with you on your range of motion to help ease you into maybe a better quality of life, that type of thing. And again, sometimes it comes down to medication just to help ease your pain so you can get on. But yeah, weather is a big definite here. If it gets cold, it's terrible. So the other thing is just be comfortable. Wear a blanket on your lap when it's cold. I try and get out in the sun on my back when it's kind of cool out. And now here in Texas, we have the heat. So again, you got to watch that.
Right.
The opposite.
Yeah.
So,
and there again with the heat, just be be careful with the heating pads and all. You know, some people suggest heating pads, but they can burn us without us knowing it. So that's always, be careful with those too.
Right.
Thank you. Anybody else want to pipe in here with any questions? Or Tom?
Hello. Just with regard to arthritic issues, I've been a quad since 1961, and I've been very fortunate in managing all of the kind of subject areas that we've chatted about today. But I volunteer with a group of similar old folks. I'm in my middle 70s, and they're able-bodied people who are suffering arthritis. And there's a good resource here in Vancouver that allows people to go in as a group and talk much like we are just now, but specifically on arthritis. And it can be affected not only by the kinds of things that you've been describing, but the diet can have a lot to do with it. And I found that after so many years as a quadriplegic, my diet and my bowel routine are not related the same way they used to be. And I think that there may be some neurogenic factors in the bowel that modifies the body's ability to make use of the necessary nutrients that keep our skin and bones healthy. But I don't know whether there's resources that you know of, Terry, that would relate directly to spinal cord injury.
Well, I don't, unfortunately, have any resources for that.
The other thing I think we might consider, and we're pretty lucky in Vancouver and the nearby territory where we can easily drive in, the outpatient nurse, while not having a spinal cord injury herself, she's been working at the rehab for probably 40 years or so, and seeing several spinal injured persons daily. And many of her patients have come back like I have and taken good advantage of the kind of information that you can share or suggest as possible solutions. And I'd encourage people to try to find that sort of resource if they can.
Yeah, Bonnie is amazing. She's our outpatient nurse at GF Strong. And it doesn't matter how many, and GF Strong is our rehab center here. I know for a lot of you who don't live in town, it's a little bit obviously harder, but I know that Bonnie would always, if you get referred to her from your doctor, she can do video conferencing with you or connect with you on by phone or however it is best for you. So she's amazing. That's who you're talking about, right, Tom? I'm assuming.
Correct, yes. Yep.
Yeah.
Do any of you find swimming help with the arthritis?
I think it's definitely something that people find is less stressful on the joints.
Right.
And gives better flexibility to shoulders and hips and knees and things.
Right.
I think it would be really good, but when you've got incontinence issues too, it's
Exactly. I've not ventured there into swimming yet, so I understand what you're talking about. So I was just wondering if that helps, you know, especially like Tom has said he's been a quad since 1961, if he finds that arthritis, that the swimming helps the arthritis.
I guess my genetics are very fortunate with respect to arthritis, but I was fairly active in wheelchair sports activities, and that included swimming. So I don't have, touch wood, I don't have overuse issues or other kinds of issues that are more common with someone who's playing wheelchair basketball or wheeling marathons. I did actively swim several times a week, up until I was in my 50s.
Mm-hmm.
I think that
Great.
was a benefit.
Mhm.
Yes, yes.
Yeah, I've muted quite a few people here, but everybody's unmuted. So does anyone have another question or comment or anything like that? Jerry, was that you? Sorry.
I hear about shingles vaccines. And so I've been a quad for almost 20 years.
Mm-hmm.
And I was wondering, it sounds like it's a skin breakdown for some people that have shingles. And I was wondering how it would affect someone with a spinal cord injury when most of your body is paralyzed like mine. I mean, is it something we should look into the vaccine, or that's what I've asked my doctor, and he says, yeah, I should go for it. But I'd like to find out more about other people with spinal cord injury.
That's a
Well,
great question. Roberta, do you have any feedback? I know I've taken the shingles vaccine. I've had it given to me. Roberta, do you have anything on that? Because I've not heard that part, which is, it's great. I hadn't thought about that before.
Yeah, it's a very good question too. I agree. Yeah, and the fact that we can't feel that's one time that I think that would be in our favor, that you can't feel it. I hear it's very uncomfortable if you get that. But then we're also prone to the skin breakdown and infection that goes with that.
Right.
So I think that's a good question to talk to your doctor. But if it's available, I think that would be a good thing, in my opinion, to have, just so you don't risk the skin issues that go with that, having the shingles, because it lasts a long time, and there's quite a bit of breakdown that goes along with that, the shingle, with the skin breakdown that happens with that.
But we could do some investigation too, Jerry, on that topic, and we could let Terry know our findings. But that's a great, I had not thought about that before. So that's a great idea.
Mm-hmm. Mm-hmm.
Can I add something on that, Terry?
Yeah, please.
About 3 years ago, I started to develop a rash, and it looked almost like eczema, and it was right from my ankles up to my ears. And the cause was difficult to determine, and it was eventually attributed to irritation somewhere in the body, which was causing me to sweat an awful lot. And I did take the shingles vaccine, as I'd had rubella when I was younger. Anyway, I would certainly, and I've been thinking lately about taking the newer vaccine, which is supposed to be a higher percentage of success, just to check that off of the possible causes. But I'm wondering if whether the nutrition from diet with respect to skin health is modified individually, but still as a category of one of the results of spinal cord injury. We may all react a little bit different to the aging uptake through the bowels. And that's really an area of research that I'd like to know as much as I can about.
Mm-hmm. And that's very true. We all age differently. And that's very true. Is exactly what you're saying. What works for me may not work for Roberta and may not work for any of you all, but it works for me. But what works for you all may not work for me. So it's all very individualized, like you said, with the food and all. And especially a rash is difficult to diagnose, very difficult to diagnose as to what the contributing factor is for that.
I've been using a corticosteroid, 0.1% topically, but my doctor, my GP, doesn't really like to see me using that continuously. So I wind up using some lotions and cream to try to keep it moist. But also, I used to love my hot shower and my warm bath, but now I've been getting some relief and some benefit from.
Are you on the
finishing-
virtual tour? At least I saw.
Sorry.
Sorry?
Sorry, Tom, go ahead. I just had to mute Glenda there.
Oh, let me try to fight this seniors moment again and just think about where I was.
Well, did they
That ended about it.
determine, Tom, what your rash was from?
Well, the original thought was perhaps something like shingles, so I got the antivirus shot. But then the perspiration, and the first dermatologist I saw suggested that the cold rinse to bring the skin temperature down and close the pores might help to ensure that it was less susceptible to bacteria. That helps a fair bit, especially with the itching. The corticosteroid is about the only way to get rid of the itching continuously, but I don't want to do that more than 2 or 3 days a week,
Right.
and then skip a week or two if I can.
Yeah, I'm giving up. I'm not gonna bother.
Sorry, is Glenda speaking with us?
No, I don't think so. I think she's on the phone. I keep muting her, but then I think she unmuted herself. So
I think she's having difficulty with the audio.
oh,
Maybe.
And so she's probably phoning someone to ask them. That's what she's giving up on.
oh,
Okay. In response to the question about what the actual cause is, I suspect it's metabolic, and that it's probably some dysfunction in the portion of the bowel that affects skin health. It's crusty, kind of almost like eczema, but and extremely itchy. So I hope that none of you others experience that as you age with SCI. But if I figure out anything that works for me, I'll certainly let Terry know.
That'd be great.
So one thing, Tom, I think we've talked about this before, and perhaps Patty and Roberta, you can comment on this. But one thing I've noticed for myself is my tolerance of food. So I was like the human carburetor. I could eat whatever I wanted, didn't matter what it was. I've never had like weight issues or anything like that. But in the last few years, I developed pretty bad pain, gut pain. And whether it's like gas buildup, I don't know whether it's like something from the suppository I use. I have no idea, but anyways, I can't seem to figure it out, but I'm trying really hard because I found out I'm also allergic to certain kinds of foods, which I never was before. So I have a sensitivity to dairy and gluten and eggs and bananas. And now it's I can't eat anything. So whereas I could eat whatever I wanted before, now it's every time I put food in my mouth, I get pain. And I don't know if it's a combination of, and maybe it's something similar for you too, Tom, maybe something in your diet is irritating your bowels, therefore it's coming out and in some way skin reactions. Who knows, right? But
I'm pretty sure that that's at the base of the problem, but I don't know what kinds of things to emphasize more than or even eliminate to try to improve it, but we're working on it.
Yeah, I went to a naturopath and had a blood test done, and then they send it away to the States actually and get so they do 92 different allergens rather than the one that our medical system pays for. It's only something like 20 something here. So, and it's a skin test. So the blood test is a lot worked really well for me. If I totally, completely cut everything out of my diet, I'm really good. I'm really good. Not 100%, so I'm still working on it. But yeah, the bowel thing has been a huge issue for me in the last few years. And
you still have your gallbladder, Terry?
I do, yeah.
Did they test that to see if there's stones or anything in your gallbladder could be causing the pain?
I don't think so. I don't think that's been tested. I mean,
That might be an option.
Okay.
As we age, we can get stones in our gallbladders too.
Interesting.
Yeah. So
I was having, and my doctor's been checking me out, and one of them was my heart, and then so I went in for the ultrasound, and what large stone in my gallbladder. And to me, it sounds pretty large. The doctor, I haven't really talked to them, but I wanted to find out about spinal cord injured. If they have a gallbladder attack, how do you feel it or find it? Because they tell me just to leave it, it'll just be fine. But if I had the attack, how does somebody with spinal cord?
The main one would be nausea and fever. Roberta, do you know anything else? I know several of our friends have had gallbladder attacks, and that's the main thing they say is fever and the pain, the nausea, the vomiting, the whole gamut there.
How do they know that that is not related to something else, though?
Right. The stools can tell you as well. If your stool is looking discolored, if you see the gray, the yellow, that could indicate a problem with the
If you see yellow in your stool?
Yeah, if your stool should be, I know this is something, it's a whole nother topic, but your stool has a healthy look to it and a not healthy look to it. And a healthy stool should be black, not tarry black, but it should be dark. And if it's not, if you're seeing something that's looking constantly, like you see blood in there, or if you see like a yellow stool, this is something that's unusual for you. It's something you need to probably get checked out. But gallbladder disease can sometimes, you can see that in your stool as a yellow stool, I believe. Does that sound right, Patty?
Yes, yes.
So
but I've also heard the fever and the discomfort and the vomiting definitely needs to be investigated by a physician to see. And especially if you still have your gallbladder, that's definitely something to investigate.
So there's a difference between gallbladder disease and gallstones, or is that the same thing?
It's kind of, in Roberta, kind of hand in hand.
I would say.
The stones can contribute to the disease.
Okay.
Correct?
Yes.
Roberta?
Yes.
And it can kind of come and go, because I have gallstones, and I sometimes have a difference in my stool as well, but it comes and goes. It's not there all the time, and usually I can attribute it to eating too much sweets or something like that.
Right. And especially gallbladder, depending on what you're eating. If you're eating lots of fat and you've got an irritated gallbladder, you're going to feel that too. And people can go on with an irritated gallbladder, but it gets to the point where you're running fevers, you're nauseated all the time, you're vomiting. It's time to get checked out.
Heartburn too?
Roberta, I don't believe heartburn goes along with gallbladder. Do you, Roberta? It can contribute to it, yes.
Because like with my gallbladder, with me, about diet-wise, I've been doing, and but then it was quite a surprise that they told me through the ultrasound that I had the stone. It was quite a large one, and how did I get it? Everything about diet has been fine for me.
Right, and sometimes there's nothing you can do to prevent it. It just happens. Right. So that's what happens.
Did someone else have a question?
I have a question.
Yeah, go ahead, Jeff.
It's about compression therapy. For I know that's something that they briefed on. For about 15 years, I was in 40 to 50 and getting blood clots recently. The doctor upped it to 40 to 50 compression. Is that normal?
I'm sorry, what do you mean by compression?
There's a class of compression. It goes 20 to 30, 30 to 40, 40 to 50, 50 to 60.
I have no clue of what you're speaking.
Compression
So
of
before you
what,
answer
yeah.
the question, I just want to know
Is it a compression
what you're
stalking?
talking
It's how
about.
much mercury is pushed against the leg.
Oh,
Yeah, and that I don't know. Roberta,
Okay.
do you know? I don't know what the amount should be.
Yeah, I'm not familiar with that, and I'm sure it has to do with the size of the person, where what they're trying to prevent, where they're trying to present too. So
Right.
I'm sorry, I don't have an answer for that.
I know. As nurses, we will admit when we don't know the answer. So I don't know the answer to that, Jeff. Compression has come a long way, especially since Roberta and I started nursing. It's come a long ways with the amount of compression and all that needs to be done. So I don't know what's best for you with your blood clots. Are you on medication too, Jeff?
For blood clots, no,
Yeah. Okay.
not currently.
Okay.
Jeff, when you talk about compression, is it lower body?
I wear them on my legs, like
so stockings, yeah.
below the knee, just above
Okay.
the knee,
Are
like
they
around the knee.
Are they fabric or are they air inflated?
No, they're fabric.
Okay.
And I guess it depends too. Are they working for you? Is it helping with the edema or the swelling in your legs?
I don't have any edema now.
Okay. Well, it sounds like that's a good place for you to be, and as long as your legs look healthy, I think that sounds like a good place to be. Whether it's
I agree.
a normal number or not, it's what works for you.
Right.
Okay. And no clots now.
Good.
See, there.
That's the whole goal, Jeff. That's it. That's great.
Good news.
Yeah.
I have a question about osteoporosis. Can low testosterone in men also contribute to osteoporosis?
That's a great question. I'm not real familiar with the testosterone value of that. I know men can get it. That's something I'd have to look into. Patty, do you know? I
was going to answer yes, but it's only, Terry, because I've heard just a snippet of osteoporosis related to low testosterone, but do not quote me on that one. But I have heard just a little tiny bit that the answer was yes to your question.
Okay.
But that we would have to do more investigation with that one too.
Right.
And I can make a list here what we're going to look up for you all: the shingles and the osteoporosis, which is great.
And the other question I have about, like, specifically with women, is there any research studies, or do we know how menopause and SCI affect women? Or if it's the same, if it's...
Yeah, I don't know if there's probably studies out there. I'm not familiar. I'd have to look into finding, seeing what's out there. But I believe it's got to be the fact that we are sitting in a chair, that we're immobile. I think that we're still going to accelerate through the process more than an able-bodied person, because I know people out there in menopause that have had osteoporosis. All they had to do was pick up increase their D3 and calcium and go to a jazzercise class, and that worked for them. Whereas me, I can't do that. I can't go do the jazzercise. You can get on a standing frame, but the jury's out if that completely helps, build your bone density. And there's too many studies that say that have, what do I say? It's not been
proven.
Proven. Thank you. Yes,
proven.
I looked into osteoporosis with spinal cord injury as a quad.
Okay.
And I mean, I did take drugs for quite a few years, but then my physiatrist said, that there is really nothing out there that works. And I also looked online for ages. I talked to different groups of people around the world, and they were taking drugs because the doctors had recommended them. But the only study I found was through, I think it was Northwestern University in the state, and it was in conjunction with the vets and Dr. Tom Schneitzer or something like that. And I asked him about it, but his studies were never complete. He said it'd be completed in 2 years. So then I contacted him again, and he said the study still wasn't complete. But that was the only study I found. And there were only like 6 participants in the study. And it was, so there's really nothing definite out there that says anything is useful. So why take the drugs when there are other side effects that go along with them possibly? I don't. So I quit taking stuff. But I've broken bones, many bones for years, even while I was taking it. So.
Do you, as high paras and quads that have been going through menopause, do you sweat?
When I went through menopause, I got depressed, I think. And it's like I was spaced out for years. But I don't know if that's related to depression or whether it's related to spinal cord injury and being a quad or what. I have no idea.
Right. You could have gone through that even as an able body.
Yes.
You don't know.
Yeah.
Terry, did you ask, do you still sweat?
Yeah, so I don't as part of my spinal cord injury, I don't sweat anymore unless there's something wrong with me.
Yeah,
so, like AD, right? But, I was wondering if when you're in menopause, because many women go through hot flashes and things like that, if as a quad or a high para, if you get that or if you don't.
I didn't get, as far as I could tell, I didn't get hot flashes. I don't get headaches. I've been really lucky that way. I very, very rarely get headaches with anything. My sleeping was okay. So I don't know if I would say that I was just luckier than many people with regard to menopause anyway.
Yeah.
I know my sweating and my headaches and all come from the autonomic dysreflexia. So I still sweat in the heat. And I've gone through menopause. So.
Okay.
Can you hear me?
Yes.
Yes, Glinda.
Finally, I've got the audio working. When I became menopausal, it improved my body no end. I was underweight, had no appetite. My stomach barely worked properly, and that was for years. And after menopause, I started putting on a bit more weight because I had an appetite. And previously I didn't sweat, but now I do sweat. And it's I never had underarm sweating or anything after my injury, but now I do. And I still get dysreflexic and have all of that stuff. But I found that the menopause actually put me further along the return to normality.
Interesting.
Great.
Apart from the fact, of course, my sleeping is not very good, but then it never was because I had to wake up and turn and all of that junk.
Yeah, interesting. Thank you for sharing that.
Yes.
All right, people. More questions. I'm always asking all the questions, so open it up.
I seem to get more bloated.
There's been some great questions, I have to say, though.
Did we ever, I missed the very beginning, and I'm sorry, so I'm wondering if you talked about suppositories and then the after effect of suppositories sometimes.
I did not discuss suppositories.
Yeah. There's a discharge sometimes that follows hours later. And that's, can be a little interrupting.
Yeah, I don't use suppositories. Roberta, do you have anything on that? Or anybody have anything on that? I don't use suppositories, so I know what you're talking about.
I use them, and I don't have any of that at this point, but I've known of people that do, but it's just, it doesn't seem to derail them from their normal activities. It's not enough of a discharge to derail them from other activities. So I don't really have much to say on that. I'm sorry.
How much discharge do you have, Teresa?
It varies. Like sometimes it'll just be like a fluidy, a little bit of fluidy gel stuff, you know, but other times it will be more than what I would like. And I haven't figured out really if it's what caues it or,
right.
Yeah.
One thing I talked about it with, because I get the same thing, Teresa.
Oh.
I
never used to.
Yeah.
So I'm wondering if it has to do with time in the chair too.
Yeah, I've been getting it more and more recently, and for me again, like going back to my food related issues, but also one thing, I use the Magic Bullet. I don't know if you use that, but one thing that Bonnie, the nurse at GF Strong, suggested to me is that it perhaps might be too strong. Because there are side effects of like cramping and things like that using it. And it could be putting so she tried using a half for me. I can't really cut them in half myself and insert them. So I have to figure out a way to really try that. But I mean, it might be something that you might want to try or,
Okay, thanks.
Yeah, this is Glenda.
Yeah, go ahead.
Teresa and I have discussed this before, but I'll just put my 2 cents worth in. I don't use a suppository, and I always get tons of after drool or whatever it is. And so it's always better for me if I don't have bowel movements or do a bowel routine too often. If I do it, if it's an everyday thing, then I have that mess for the rest of the day. And if I only go once every 3 days, then it's a mess for that day, and then it doesn't come as much for the other 2 days. So it's, for me, it's a trade-off, but it just, it's ever present, and there's lots of it.
Can I offer an insight?
Yeah, please, Tom.
For the first 40 years of my injury, I didn't require any suppositories, but as things change, I've been using the bisacodyl. It's a bit different, I think, than the glycerin ones.
Right.
And I find they work quite well. And with regard to the major portion of the BM is fairly normal, but then there is an after discharge. But I find that if I eat beans or other gassy kinds of food, it tends to shorten the time span between a BM and that occurrence. And just staying on the toilet a bit longer and waiting the patience does sometimes pay off a bit. So it might be worth trying.
Thanks, Tom. Yeah.
Thank you.
Yep.
When things go difficult for me, what my wife has a recipe for, it's called beans. It works really well.
Sorry you cut out there, Jerry. Could you say that again?
With me, what happens is if I get constipated for more than a few days, I usually pull out the bean soup, and it works really well.
Oh.
Share the recipe.
It's really good. It's got local shrimp. It's really nice.
Oh, good.
Works really well, and then just brings me back on track. But I use the Magic Bullet, and to me, I call it drool, and it's just part of. I remember when I was at
drool,
went down onto the mats, and the physio would say, "Oh, skid marks, back up the floor, changed." But I mean, that's just always with us.
Yeah.
just part of the bowel routine, and just, okay, when that's done, I'm done. And that's why I spend, my morning is my routine. Sometimes it's good, sometimes it takes a while, but as long as you get rid of the drool, you're fine.
Right.
Yeah.
I found that the evening routine gives me more time, and having been up all day, things are a little more ready to go.
I have a question, seeing how we're in that area of our bodies. Has anyone had the experience with having investigative stuff like sigmoidoscopies or colonoscopies or anything like that, and the preparation to before that?
Yeah,
Yes, I have.
I have.
Who's that?
Jeff.
And Diane.
And how did the prep go for you?
Brutal.
Like a jet plane.
Yeah.
Any advice?
It's probably useful to have the investigation done, but don't be planning any major social events right after.
No.
I don't know how
It's
you
about a
do
week.
it.
Well,
As a quad, I don't know how you do it.
I'll tell you what you can do to make that prep a little bit better is for the 3 days before is really watch your diet. Just want to get into a real low residue diet.
What's that?
What does that mean? Sorry, Roberta?
I'm sorry? Can
What
you hear
does
me?
that mean? What does the low residue diet mean?
Yes, that is where you avoid meats and the fibrous things, the grains. You want to just stick more with the broths and jellos and things like that. And I can get the whole diet for you. I don't have it right at my fingertips, but there is such a thing, and I can get that out to you if you'd like that. But if you can do that at the beginning for the first 3 or 4 days before you even go through the prep, it makes the whole process so much smoother.
Yeah, because they're quite specific with what they want you to do prior to it, I believe, aren't they? So what you're suggesting then is to be preemptive and do it even a few days before.
Right. Absolutely.
I am worried. I mean, I've had mucosal distension or prolapse, whatever it is, and that has caused a lot of my after BM mucus. But it was caused, my prolapse was caused by the use of magic bullets way back, and it just used to be so violent that it just pushed everything out, and I've never been the same since. So I've stopped using them and let my body do its thing with some coaxing. But I'm worried that prep, anything they give you to clean you out, is going to exacerbate my prolapse. I can't afford to have a bigger prolapse than I have at the moment. It's bad enough to manage it now, let alone. So that's why I put off having a colonoscopy. And I think I need one. So.
I was thinking instead, like I saw on The Nature of Things one time, they had an internist, and the reporter swallowed a camera. And I thought, this is great, right? And it's a camera that takes pictures. It goes all the way through your body and comes out the other end. I don't know how they collect it.
So I have to interrupt.
Then why would you have to have a colonoscopy if you did that?
Well, I actually asked a medical person about that, saying, well, wouldn't it be nice if I could just swallow one of those things? And they said, yeah, the sad thing about that is that if there is any matter in your intestines, they can't see it. So you have to do a clean out anyway, even when you're taking one of those cameras, because they can't do a visual on all of the, it has to be clean before they can do a visual on the intestines. To see if there's any polyps or whatever it is, bad stuff happening. Yeah, I thought that was the way too, but
a bummer.
A bummer.
Anyone else have some questions for these ladies?
I have a weird question.
All right.
Okay. I just was speaking with my respiratory therapist, and I was wondering about CPAP. I was the 6th referral that he had in a year for CPAP that did have a spinal issue. Is that common?
I think CPAP is common as we age anyway. I don't know if it's any more common with spinal cord injury. Roberta, do you have any thoughts on that?
I don't know that it's necessarily increased with spinal cord injury either.
No, neither.
It really, I think that's goes with weight a lot of times, and the way people sleep. So
and the fact that the muscles in that area, or generally the muscles, are more flaccid.
Exactly.
Yes.
As we age. Yes.
I have heard a research study that was done, and you might want to, I can probably get it to you guys, but that especially higher level injuries have more issues with breathing when they're sleeping. So it's very common for people, quadriplegics, tetraplegics, to have sleep apnea. So I did see a research study on that, and I can find it for you, Jeff, if you like.
Okay, and then my doctor said that weight is a fallacy, that it has nothing to do with weight. It's more to do with your uvula.
Well, I think it goes along too, Jeff, as to how you sleep. If you sleep laying flat, then everything is naturally going to be pushed more up in your throat, So I know I always sleep a little bit of an incline myself. So my head's up. I'm not sure how you're sleeping, but I know that has a factor to do with it too. That it's not necessarily weight, but just everything being pushed.
If you had any nasal problems too, that might affect it.
Right.
I find that if I lie on my side, I don't get any issues. But if I lie on my back, for instance, if I try to take a nap during the day, I actually can no longer fall asleep on my back because I keep getting that little, whatever it is in your throat that relaxes when you hit the sleep button, and it wakes you up. So I've discovered that. However, I think I do get some sleep during the night if I lie on my back, because I tried to have one of my sleep cycles on my back. However, on my side, it does not kick in.
Tom, were you going to say something there before I rudely interrupted you?
No, you actually helped, because I misheard Jeff with respect to the sleep apnea, and I thought it was an acronym that he was using. And my old ears they're helping with the earphones, but not perfect.
So is Jeff able to sleep other than on his, do you only use your back for sleeping, or are you able to go on your side, Jeff?
The back is danger. The side is way better. I do sleep in the hospital bed also, so I do sleep inclined.
So do you get the sleep apnea when you're sleeping on your side?
Well, I wear the mask and the machine, so I don't know.
Yikes. Yeah.
But I was always sleeping 2 hours, and now I sleep 8.5.
Oh, well done. And you're tolerating that machine, hey?
Oh, it's fine.
Well done, you.
I can't sleep without it now.
Well, that's wonderful. I'm sure it makes a big difference in your life.
I feel alive.
A friend tried, she recently went on to a sleep apnea machine and at first tried the nasal one. I mean, it covers the mouth and the nose, and found that was really difficult to sleep with. And then she just uses one with the two tiny tubes that are up her nostrils. And she said that works way, way better and not a problem for her at all.
I know they tried CPAP with me in the hospital right after extubation, and I was too claustrophobic with the mask over my face. I couldn't tolerate it. So it's good there's other options out there for sleep apnea.
Yeah, I think there are.
Sleeping. So we know that probably a lot of us have problems with sleeping anyways. How is that affected? Are there any tips you guys have for getting better sleep? 'Cause I'm definitely finding that these days I'm up at 5 a.m. and I cannot. And then by 9:30, I'm exhausted and nearly ready to crash. So.
I find naps are good throughout the day, but if I have too many, I know I don't sleep well either at night.
I think getting out there and getting some exercise through the day and just some fresh air, that really helps me. And by exercise, I mean just rolling around. I try and go around the block, or or you can do some exercises with, just sitting in your chair, that kind of thing. But exercise and the fresh air just really helps me. Diet as well too. You don't want to eat too late before you go to sleep, because that will keep you up. And depending on what you're having, caffeine is going to keep you up. Alcohol, sometimes people think that's good because it'll make you sleepy, but it disrupts your dream states. So that's difficult to avoid. And then I have to get up in the middle of the night to do my catheterization. So I'm up in the middle of the night anyway. So I've just kind of got my sleep pattern down now. But that can definitely interrupt, and there's not a thing you can do about that. So I think it's finding what works best for each of us.
And I think that, Terry, goes along with aging too.
Yeah.
So I think I don't think that's special to spinal cord injury. I think it just goes along with aging.
Yeah.
I find that if I can get a 4-hour straight out when I first go to bed, if I can get a 4 hours in and then I get intermittent from there on, is fine. I can tolerate that. And sometimes I have to have one day out of I don't know how many where I just try and not do too much. I try to do a catch-up day is what I'm trying to say,
Right.
Yeah, that's smart.
Yeah.
It's the spoon theory, right? We only have so many spoons, and we have to distribute. You're given 12 spoons, and you have to distribute them throughout the day, and about managing what you're going to do, and how many spoons you're going to give each one.
It is a bit unnerving, though, because of the new research that's come out that suggests that if you don't get 7 to 9 hours of sleep, they say preferably 8, it sets you up for multiple problems, not just the ones that we guess at now, but they're attributing lots of problems to lack of sleep, and that's always worried me, because I know that my sleep has been disturbed for decades. So I guess trying to catch up with a nap or whatever, I don't beat up on myself when I have to do that. I realize that it's a necessity, really, that you've got to keep those hours of sleep in.
Yeah, that's great. So anybody else have any comments to make?
Maybe I could add something about a subject I mentioned earlier with regard to the skin issue. One of the things that the physiatrist suggested and I've been using is a medication called sulfasalazine, and it, I think, helps to, it reacts with the bladder wall and decreases the amount of irritation that the rest of the body feels. The object of the medication was to try to reduce the amount of perspiration and sweating that I was having. It resulted in all that skin issue. But it also gave me a little bit better duration of sleep. And I'm one of the fortunate ones, I guess, that can get 8 or even 9 hours or up to 10 hours sleep at night. But before taking this bladder desensitization, I would wake up and have to do a catheter midnight, middle of the wee hours. But now I'm okay for about 8. And then I do a catheter and go back to sleep quite easily for a couple more. So, yeah, if there's some way of helping the body stay more relaxed and comfortable, then that may help your ability to continue sleeping or to get back to sleep.
Yeah, it's interesting. And then I'm just starting to participate in a study here for the bladder. And so I had to wear a blood pressure monitor because when my bladder fills, I get AD, right? I don't normally have to get up in the middle of the night, but they were so surprised at how high my blood pressure went while I was sleeping, just lying down. And they're not certain if it's just my bladder filling up and my body reacting to that, or is it because, so I can't be sleeping well if my blood pressure is skyrocketing up to 130, right?
Right.
So it's interesting just knowing that knowledge and, okay, what's going on while I'm sleeping? Is it my position? Is it my bladder? Is it something is irritating me? Obviously, so.
Good point. And I wonder, will that research soon be available to others?
It is one that I sent out recently, the Toviaz one.
I'm on Toviaz.
Oh, yeah? Yeah.
Which one was it, Terry?
It's called Toviaz. So it's Toviaz.
Okay, I'll take a look.
It to you, Tom.
Okay, please.
Yeah. Yeah.
Did Teresa have a comment?
I've been using it for a number of years now, as like it's just another bladder antispasmodic drug, and it seems to work pretty well for me.
Yeah, this study in particular is testing
blood pressure. I think that
the effect of AD to see if it will reduce symptoms of autonomic dysreflexia and your bladder. So.
I have a quick one. Well, it's not a quick one. I just want to know if anybody's ever tried a decompression chamber.
Oh, decompression chamber.
Yeah. For oxygen therapy, I wonder, would it clear the head up if you're getting dizzy? Would you're feeding your brain a little more oxygen? Would that be good for you? So I just want to know if anybody knows anything about that. My battery's going to die here soon, though. But, if it's good for spinal cord injury, or if there are problems with it or not, or.
I've heard that it works well with wounds.
Right.
With the extra oxygen.
Right.
Have you worn a little oxygen percentage finger cuff that they use in the hospital?
Well, just when I go to the hospital, or for when
in checking the
blood oxygen level. Yeah.
Mm-hmm.
So how do you get your blood gases checked without going through Emerge or being in the hospital?
You don't. You have to get it taken out of the wrist.
Yeah, out of the artery.
Mm-hmm. Yeah, and it hurts.
Oh, I thought that they just put that little that peg clip thing on your finger.
No, that doesn't.
That tests your oxygen level.
Yeah.
your oxygen saturation, how much oxygen is flowing through your body there.
So how do you get one of those put on your finger without going through a merge?
Just go get one. Any medical supply dealer.
Yeah.
No kidding.
Yeah.
Sure.
Yeah. I think they rent them too, actually.
Oh, do they? They're only about $50.
Oh, yeah.
Yeah, they're not expensive.
Does anyone else have any questions for Patty or Roberta?
I think Roberta left us and she had to drop.
Oh, okay. Okay, sounds good.
I think she's gone. So any questions for me?
The reason I don't have many questions, I find, is because I have a lot of answers. I'm just realizing this, that I don't have questions. And it's because with CIBC, I found that they cover a lot of these topics. For example, the cooking class tells you all about diet. They cover, the few that I've been to, they've covered every aspect of difficulties. Everything that has been mentioned here, they have answers diet-wise. So that's natural. They're never turning, in the cooking class, they're never turning to pharmaceuticals, ever. It's always natural diet, and they call it the grandfather diet. Whatever your grandparents ate, eat that. Whatever your grandparents did, do that. And that means using yourself as a test subject. That's what I do. And I find it's imperative to do my own analysis and assessment. And what I find is that exercise and diet, they provide huge preventions from all difficulties. And you covered that actually right at the beginning when you came up with the preventions. And that for me works. Diet and exercise. Well, I feel we need to find out how, with our own difficulties, how we can become more active. I think that's the key. And the other aspect is diet, and you can avoid all manner of these artificial doctor prescribed things that are horrific. That's my experience.
I agree.
I agree too.
What has always got me upset is when you take an antibiotic, and as I've just been to a gut seminar, and you just have to take one antibiotic and you eradicate your gut flora, and of course that affects how you digest your food and how things move through, how fast, all that junk. So repopulating your gut every time you have an antibiotic, and whether you can actually get it back up to a level that is good. I mean, you can do all the stuff, but it's a bit worrying, because I'd love to live without antibiotics, but with a bladder like mine, you can't.
Well, Tom made the point that over 40 years he was largely problem-free in many areas, and now is not. And what that tells me is that in using oneself as a test subject, you can determine what it is that has happened. How can you go back to where you were before? And I think that's to do with activity. Has it decreased? Does it need to be increased because of age? So you just increase your activity. This is what I've done. I'm active every day now in any way that I can be, and that's an answer. That is a real solution.
May I ask how often you have had to take antibiotics?
Never.
There you go.
Yeah, I avoid it like the plague, because I believe it is the plague.
If you get a raging bladder infection, what do you do?
Well, when your diet is good, you don't get that. Cranberries. When you study the natural food answer to all these symptoms, all these problems, and you do it, I find that, well, when I do it, and I do it, well, my diet is clean, and it has to be. If it's like the rolling RNs were saying right at the beginning, it's an hour by hour thing. It's not, well, this week or this month. It's hour by hour that we need to think about our activity and the diet. What are we putting in? And whatever goes in determines the output, and that's a formula that works. Beautiful.
Now, I'm in complete agreement with you, and I have to admit I'm as compulsive as the net. You know, I watch what I eat very carefully, and I do all the cranberry and all of that stuff. So I think for some reason or other I have a persistent bacteria, you know, and it rages its ugly head more often than I like it to.
Well, it's expensive to employ certain cures. All the cures I know of are natural dietary, and it involves organics. It involves.
Well, I everything I eat is organic, and the issue is that I think have a perfect diet and I have a perfect life until a bladder infection hits me, and then I think, what have I done? And I have to look back, and I can't, other than procedure with my catheterization and the fact that I have so much bacteria hanging around in that area.
There's no hard rules involved. It's everybody is different, and as was mentioned here, we have to use ourselves as a test subject and find out, as you're doing. Keep researching. I think it's Google is there. There's a wealth of information online, and that's what I use. Any concern I've had, health concern, I've addressed online, and I come up with answers that work. It eventually works, and it might not work after a week or two. It might take actually several weeks or months.
Well, I would really love to know if ever you get a bladder infection that you're able to get rid of completely without antibiotics. I mean, I've gone weeks and weeks with high water flushes, lots of crap. I mean, I've done everything for weeks and weeks and still suffered from that damned infection. In the end, I've had to take the antibiotic.
Well, then what I do is I find out what the natural antibiotic is, and garlic is incredibly powerful.
So how do you take the garlic?
Well, I have. This is what it comes down to. I'm not a mad scientist. I'm a bad scientist, I guess. But what I do is I get these things. I find these gadgets. I have this gadget that is it presses the garlic. It's not a garlic press, but it presses it in a different way, and it makes it into a mince. And I use it that way. I mix it.
What do you mean by you use it? Do you just take it raw?
I mix it with my guacamole mostly.
So, okay, so you're taking it raw?
Yeah, raw, mixed with guacamole, lime juice, salt, anything natural. That's how that's done. And then the other thing is you can freeze an entire lime, because the power foods are garlic and citrus, lime, lemon. I freeze the entire organic lemon, and then I grate it on a cheese grater, all of it, the rind, the peel, the pulp, the seeds, and I use that in a smoothie. And other power foods like chia seeds, you just have to find out what these power foods are, mix them all up, and whatever agrees with your system. And I take those regularly. Turmeric is another thing. I buy the organic root, and this is a lot of work. I don't have much time to do anything. I don't have a TV. I don't have time, because I'm doing all this stuff all the time. It's like the rolling RN said, it's an hour by hour thing, and it takes a commitment to do it. And it works. Like, it works beautifully.
Yeah, well, I find that as well. I mean, to me, it's about the food, but the thing about the food is the nutrition in the food. I know. So I find instead of organic food, homegrown food, we grow our own. So we know what's in the soil. We taste the nutrients. We see the green, and that really works for us. We go to buy organics, and a lot of it looks nutritionally depleted.
Oh yeah, the soil is depleted, and so it's depleted if it's organic or not. But that's where you have to be mindful when you shop.
Totally.
You have to see what it is. Is it vibrant looking? Does it feel right? Just like you say, like tomatoes, even if they're organic, they're no good unless I find the heirloom tomatoes are the only good ones.
That's right. I agree.
Yeah, it's because they're full of.
One thing that Brandy kind of suggested, and perhaps Patty, you can kind of comment on this as well, is how it's really important to find out what is causing the infection and what that infection is, because it's very common for most of us to have E. coli, right? But unless they're treating that infection appropriately with the right antibiotic, if you do have to go in that way, it's really, Patty, I think you're on mute, so.
Yeah, unfortunately, the only way to determine what's in there is by having a urine culture done. And then as I've been listening to this conversation, a lot of it, when you get into the antibiotics, then you have to watch your stool softeners, the whole other end of that as to what do you need to do. I always feel like you got to stay one step ahead as spinal cord injury. So yes, you need to find out to make sure that the medication they put you on is specific to that bacteria. Or if not, it's useless for say 7 to 10 days of medication. And then
when I take my sample in, they test it and they say yes, it's out of range, and then a day and a half later it comes back with sensitivities, and then they prescribe according to the sensitivity. And you know, with E. coli, you use the least wide spectrum, so you use the most specific antibiotic. Right. So I mean, my urologist has switched me from macrobid now to ceflixime. So
unfortunately for cultures, they can take up to 72 hours for a final read.
Right, and
you're already 3 days into an infection.
But I never take an antibiotic without having it. You know, it goes to full culture. Sure.
Right.
Well, the other thing too is that they're always going to find like if you do catheters, it doesn't matter. They're always going to find bacteria in our bladder, right?
Yeah. And I can tolerate sludge and stuff like that in my urine, and but there's a difference between dirty urine and, you know, bacteria in your urine and having an infection. An infection, it affects your life such that you are looking for a drug.
And I mean, there are people don't want to mess around with infections too, right? But I think like Robert and Jerry, like they're making a good point, is that sometimes, you know, I mean, it is a whole lifestyle change, right, to try to get rid of it. But I mean, there are people who unfortunately get septic because they leave their infections for too long, right? So you have to treat if you're, you know, symptomatic, right? You don't want to mess around with that. And then looking at, you know, it could also, if it's E. coli, correct me if I'm wrong, Patty, but E. coli can be very common in just how we wipe, right, after.
Right.
Because most of the time it's, you know, bowel stuff, and because we're doing it usually,
like that.
Not the cleanest way, you know. Some people have to do dig stim or, you know, whatever. Anyways, that can, if it's the same thing coming up and over again, maybe you know, there are other things that we could be looking at, probably.
I found it interesting that I can go I went for 3 years and had no infections.
Mhm.
And then even with no change of how I did my bowel routine and anything, I started getting infections. From what I can gather from my research is you can get a persistent bacteria that will not ever come out of the tissues. It stays in there and then just does this little reboot when it wants to. And I'm using fermented foods and organic bacterial stuff, and all of my food is organic, and I'm homegrowner. You know, all the things that you guys have mentioned, I certainly do, and I'm very conscious of. And what has sort of annoyed me, and I put it down to the fact that I'm aging, I guess, is that I've gone along doing the same stuff all along and can be clear for years and years and years, and then for some reason my body decides, nope, it's going to produce an infection.
Now, are you being treated? I'm sorry, I had to roll away to answer the door. Are you being treated each time you have symptoms, or do you let a few days go before you start treatment?
Well, oftentimes I'll have sludge, and it used to be that I could have sludge in my catheters and my urine, and life would go on quite happily. I'd get no other symptoms, and that was fine and dandy. And then I could do massive water flushes where I'd just sit and drink gallons, and and get. And then it would subside and then come back maybe later. But more recent, and over the last year and a half, the symptoms have become rather more difficult to live with. You know, there's the razor blades and the urethra and the abdominal pain from the, and the sludge is like a thick cream, and it's obviously that my body is fighting this thing. And then there's the fatigue. So I've pushed through, I've pushed through this. I've gone days and days and days with those symptoms, thinking I am going to do the lemon juice. I'm going to do the cranberry. And I push through it. And in the end, I have to take that damned antibiotic. And I think to myself, was it good for my body to have that infection hanging around for so long?
Right. And it can do damage to your kidneys. So you always have to be careful with the infection. It's kind of a double blade sword that unfortunately you have to be careful with that. Is it, just real quick question, is it the same bacteria every time when you have the urine cultures done?
No, my most prevalent ones have been the E. coli and the strep B. I have had some other ones, but when you go online, they're not uncommon. I mean, it isn't as if I've got something that's up from Mars, But it is very difficult when you have that post bowel movement mucus, you've got E. coli hanging around. Then I was using a handheld bidet, and even soap and wash with a handheld bidet every time, and I thought that was doing the trick. Then no, I get another infection. I think, oh well, maybe I should change my method. And you sort of think, God.
Right. Yeah. Unfortunately, there's just sometimes you just cannot get a handle on what needs to be done.
My urologist and I were working through it. So now you can change technique, you can up your food, you can,
Yep, and I've heard of that so many times.
Mm-hmm. It seems to be, I mentioned this earlier, it seems to be very common in our community with women in particular, and recurring SCIs that are resistant to antibiotics.
Right.
I know it from a number of individuals, women recently?
Well, I don't want to become resistant, that's for sure. And if you can be clear for weeks after you've taken one, then I assume that you're not resistant.
Do you have a follow-up urinary culture done after you finish antibiotics? Do you have a follow-up to be?
Well, I don't. If my urine is clear, and I, you know, I mean, no, it wouldn't be out of range, so they wouldn't do anything.
Okay.
You know, I mean, you become very intimate with your urine. I mean, I smell, I look, I observe, I know my volumes, my ins and my in volume, my out volume. You know, I mean, I'm very intimate with my urine, you know. And it's when there's a change of smell, I get very suspicious.
I just wanted to mention a couple things that some people have written there, and then we're kind of done for the day. So unless anyone has any burning questions that they wanted to ask Patty before we go. But just a couple things that Brandy said, her urologist recommended only seeking treatment for UTIs when they have symptoms like fever, pain, sweating, incontinence, shaking. She's also said that they've been seen increase in peers getting recurrent infections that are antibiotic resistant. And Diane said men are less likely to get a bladder infection. And then Diane also said that she also had the same problem, Glenda, and has had it for years. And she takes D-mannose every day.
Right.
Yes, I was doing the D-mannose 3 times a day. And you know, it's costing me $70 or $80 a month to do that. I did that for 2 or 3 months. Oh, no.
All right. Well, thank you so much, everybody, for joining us. If anyone has any other questions, I'm sure Patty, I could email her. You could see her on Facebook, The Roll in RNs.
Yes.
And thank you so much. It was really informative. Thank you all very much for offering your suggestions and comments and everything. So yeah, it was great.
Thank you to everybody. I appreciate it. It's been great questions. Thank you so much for allowing us to be the first Americans to be in this group.
Yay! You guys were great. Hope everybody has a great day, and we'll talk to you soon.
Thanks,
Bye, everybody.
Thank you.
See you.
Bye-bye.
Bye.